So it is with great pleasure that I introduce my special friend, Dr. Harry Aponte, who is a family therapist known for his writings and workshops on personal therapist, spirituality, and therapy, therapy with disadvantaged and culturally diverse families, and structural family therapy. Dr. Aponte was a staff member and teacher of family therapy at Manager Clinic and director of the Philadelphia Child Guidance Center. Currently, he is a clinical associate professor in the couple and family therapy department at Drexel University in Philadelphia. He has a private practice in Philadelphia and conducts trainings and workshops throughout the country and abroad. Dr. Aponte published Bread and Spirit through Norton, a book that speaks to therapy with today's poor in the context of ethnicity, culture, and spirituality. And if you don't have it in your library, I would encourage you to purchase it because it's still very, very relevant. Dr. Aponte and Dr. Carney Kissel have edited a book entitled The Personality Therapist Training Model, Mastering Use of Self. And that book came out last year in 2016. And again, it's another must read. And he's here today and he's going to be presenting on Personality Therapist, Mastering Use of Self, and probably anything else that
comes to mind.
Okay, Harry, take it away.
Going forward, I go
This one?
that way.
Backwards.
Okay. I had notes here, and I didn't realize that the whole wall was going to turn into the notes that I have. We're going to be talking about therapy, but we're going to try to expand our perspective on what it really means. The things we're going to talk about, you've read about them, they've been talked about before, but what we have attempted to do was to bring it together in a very special way. And I'll get into that in a moment. Right? When people talk about therapy, they tend to emphasize technique, models of therapy, how to do it. Right. These are the tools of therapy. I think from the very beginning, people have recognized that that if you're going to do therapy, you have to establish a working relationship with your clients. Right? And a lot has been written about that relationship. However, what I have, my sense has been, and I've read most of what's been out there on that relationship, that therapeutic relationship. It's addressed in rather general terms, sometimes almost inspirational terms. You hear things like, if you're going to work with your clients, you have to be present. Well, what does present mean? If you're going to work with your clients and have a good, effective working relationship, you need to be empathic. What exactly does that mean? And how do you become empathic? Right. So, what I've been trying to do is to look at this relationship as something that you can be trained to do, and you can actually conceptualize what it means and the steps that it takes in order to do what it is you're trying to do in a relationship. So we talk here about the To gain mastery of self in therapy, therapists must integrate who we are personally into our professional roles. What I'm saying there is that you cannot take for granted that once you're trained professionally, you have all these models and you have these techniques. You cannot take for granted that now the human being that you are is going to mesh with what it is that you're learning professionally. That it's just, now that you've trained, then, you know, your psyche and your emotional state and your personal cultural background, that all is going to cooperate and integrate in an effective way with whatever you have been trained to do as a professional. Okay. And what I'm suggesting is that some people do it instinctively, it works for them. Most of us have to put a little extra effort to make it work. And I've been doing this stuff a few years. And you know, what I remember hearing when I was in my 20s, I remember that I was at the Menninger Clinic. I don't know if any of you know what the Menninger Clinic is, but it's a psychoanalytic clinic, and it was founded in 1927, and the idea was that Carl Menninger and Will Menninger, that they were going to take what Sigmund Freud was teaching, what to do when you have your patient on a couch, take it into the hospital, because some people are psychotic, some people need to be in an institution, and take all of that theory and convert it into what a hospital program should be like. So that was the idea of it. So I got out of graduate school, and within 2 years I was at the Menninger Clinic trying to get some postgraduate training. Anyway, they were very orthodox in terms of their psychoanalytic thinking. I started to do family therapy there, invented my own version of it, and that created a little tension in the place. But anyway, Salvador Minuchin, most of you should know him by now, I hope, came one day to do a demonstration with a family of what he does as a therapist. And I was standing in the back with a friend of mine, a psychoanalyst, psychiatrist, Harry Hardin. And we're watching this, and if you've ever seen Sal do his work, it's sort of magical work. It's like Virginia Satir used to do her magical work. And it was very impressive, and people applauded after the whole thing was over. And Harry Hardin, was straight down the middle psychoanalyst, says, "See, I told you he was once trained as an analyst." That's why he was so good, right? But what I've heard, I heard many times from many people around that if you watch carefully, that therapists, competent therapists, the more competent they are, the more they look like one another. And they don't look like their particular models so much. And well, why would that be? And what I'm suggesting is that why would that be is that they had a skill in using themselves to connect with people and to open people up and to motivate them and to help them take risks that they wouldn't have taken on their own. Okay. That it had something to do with who this person is who is doing the therapy. Maybe under this cloak of being an analyst or a cloak of being a structural family therapist, but that, and then if you look at the literature from way back about factors that make a difference in therapy, that make for success in therapy, the one factor that's been discovered and rediscovered over the years is it's the relationship. Okay. Well, you know, that relationship is a personal thing. You don't relate through a technical model. Okay, those are tools. And well, if this relationship is so important, and if what you're doing when you're relating is you're relating through yourself, okay, then you would think that one would spend some time in training therapists to do the relationship in a way that's effective therapeutically. Anyway, I've committed myself for a good number of years now to try to make that into something that's translatable so that you can identify the aspects of it and you can actually find ways of doing it that you can train people so that they can do it more effectively. Right? And they can marry their own personal self to the technical models that they're trained to do. Okay, so then it says there, we do this by making active and purposeful use of our humanity, particularly our personal woundedness. Okay. Well, you do a relationship through who you are personally, right? Okay, that's not too complicated a concept. But to do it purposefully so that it meshes with what you're trying to do technically, so that you in fact bring life to the technique, bring power to that technique, bring intelligence, intuition, sensitivity to that technique. Okay, that's something else. How does one do that? Well, traditionally, going back to Sigmund Freud, what he did was when he trained his analysts to be, he said, well, if you're going to be a psychoanalyst, you have to undergo your own psychoanalysis and try to resolve your personal issues so that you don't harm your clients, your patients. Okay, so then that became a standard practice, that you go into psychoanalytic training and you go and you undergo your own didactic analysis. Didactic means you're going to learn something about therapy through your own analysis. What people don't often remember or speak to is that Freud also said, when you do your own analysis, you should be doing this interminably. That was his word. Every few years you should undergo another analysis, and then another analysis for the rest of your career. Recognizing that in our humanity, we have issues, as my daughter would say, you know, and that we always have issues. And something also that we don't tend to address directly is that we have issues to the day we die. So you can be in analysis or family therapy or any kind of therapy for 10 years, 20 years, 30 years. You and I are going to have issues until the day we die. We're not going to resolve it all, okay? But it helps us to understand the issues. It helps us to deal with the issues. It helps us to have more control over ourselves and live a healthier life. It isn't that therapy doesn't work. Therapy works. But therapy never cures us to the point that we don't have our issues. Maybe on the other side we will get to that point, but not on this side. Okay? All right. So what am I saying here in those those little orange letters that says, you know, our humanity, particularly our personal woundedness. What I'm suggesting is the fact that you and I have issues, the fact that you and I have our own human vulnerability, okay, that is why we can do effective therapy. Why? Well, the very word empathy, where we feel with somebody else, and we sense what they're going through because we can feel it within ourselves. Why is it that we can feel it within ourselves? It's because there's something of that brokenness of theirs that resonates with our own personal brokenness. It's because we struggle. It's because we know what it's like to be anxious, to feel insecure, okay, to be shy, okay, to be depressed, okay, to be stressed emotionally. It's because we have all of that in us, all these weaknesses. It's because of that that then when we have a client come in, a family come in, a couple come in, and they start telling us of their struggles, okay, that we can then maybe shed a tear, that we can then feel sorry for them, that we can then feel frustrated with them, that we can actually begin to feel what it is that they're describing. You know, but, you know, well, you know, you go to a physician and you say, I have this symptom and that symptom, da-da-da, or this hurts and that hurts, and whatever, and inevitably, if there's something to what you're saying, you're going to get blood tests and you're going to get x-rays and you're going to go through all kinds of machines so that they can find out what it is, because the physician, through the words that we're using, we cannot fully communicate what's going on within us. For one thing, we don't understand what's going on within us. We're feeling the symptoms, but we don't know the causes of it. Okay. Well, because of our own broken, vulnerable humanity, when you and I sit down with a client, okay, if we want to, we can open ourselves up, okay, our own vulnerability to ourselves, so that when we then engage them and listen to them and walk with them through their own journey, their own struggle, okay, we have within us something that says, oh, I know something of that. I'm not exactly there, but I know something of that. I've been rejected. Okay. I've lost a lover. Okay. I've been terrified and been frozen and not able to perform. Okay. We know something of that, and because we know something of that, and if we allow ourselves, and we don't stuff it through our shame and embarrassment and guilt that we're not perfect, and we allow ourselves to be open to that humanity within us, okay, then we can use that to experience something of what our clients are experiencing, so that we begin to then feel, okay, something of what they're going through. So when they describe something, okay, we can begin living it. You know, you watch a movie, and if it's a really good movie, you're crying, you're angry, you're upset, you forget, you know, that there's any space between you and that drama. You're in the drama, okay? And it means something to you because, yeah, I know what it is to be terrified. Okay? I know what it is to be in suspense. Okay? I know what it is to worry that this is going to happen, that I will not be able to get out of this terrible situation. Okay? Well, the same thing can and should happen with our clients. That's true empathy. That's living it. And what that does, okay, is it opens us up to not only be able to feel with a client so that the client says, oh, this person really cares, but it gives us an understanding of what they're going through that they have not been able to fully communicate. But we're able then to speak to it, and then they say, oh, he really understands, or she really understands, right? You know. and then that then opens us up to having a relationship, to being able to do an assessment, because then we're doing the assessment not just because we have 50 questions from a questionnaire that our agency has given us, okay? But we know what questions to ask, because we're beginning to feel what it is that they're feeling, okay? We're beginning to have the same pain that they have. And they start telling a story, and we have something in our lives that reminds us of that, okay? And then if we're walking that same walk with them, we say, well, if they're telling me this, then they're probably also feeling that. And that may be the thing that's challenging them at the moment. So we begin to have intuition. Okay? We begin to know things about them that they haven't yet expressed. We may not be sure of it, okay, but because we know something of it, we can go there with them, and then we can begin to explore that. And the more they tell us, and the more they tell us in a way that really communicates not just words, but their emotions and experiences, okay, the more we get into it, okay, the more access we have to them and to what their life experience has been, so that it really helps us with the relationship, it helps us with the assessment, and it helps us with the intervention, because we also know, well, if they're in this particular place, I know what that would be. I don't think I would want to be asked a question this way. I think I'd want to be asked a question that way, okay? And I think I'd like to hear this person treat me in this way when they make this intervention, rather than in that way, okay? So that we begin to get really smart about how to use the tools that we've been trained to use as therapists. Okay? So that we're meshing into that person's life, we're getting in there, okay? And we're knowing that person from within that person through who we are in this intimate relationship with them. You got to be trained to do that, I'm arguing, okay? Few gifted people do it without all that training. Freud never, by the way, underwent a psychoanalysis. He told everybody else they should. He used to just look in the mirror and talk to himself, you know. Okay. Well, going to add another dimension to all of this. Because I remember when I was at Menninger's, it was all in my 20s. And I still remember this one particular professor, you know, he said, well, you have to understand the patient, and the family is a given. You don't have to understand the family, you can just understand the person, okay? What's the family got to do with the person's issues? Who knows? Not important. Okay. Well, you know, I think we've gone past that one. But now we're also trying to take into account the social context in which people live, and how that affects their sense of identity, their sense of value, their sense of power, their sense of usefulness. Okay. And it's also can be a source of stress, can be a source of support. Okay. We live in society. Okay. We live in communities. We go to schools. There are hospitals, there are institutions. All of those affect us, how they treat us, how they view us. Okay. We begin to see ourselves in the same way when we go to some place and they look at us and they kind of ignore us because we're not that important. It does something to you. I'm Puerto Rican. I grew up in New York, South Bronx, Harlem. I remember going to a store and then I'd be the last person they'd pay attention to. And everybody else was white and I wasn't. Well, white in those days in my neighborhood was you were Jewish, Irish, or Italian. I actually, I don't think I ever met a white Anglo-Saxon Protestant until I went to Menninger's. I was in my 20s. So I knew these were the white people. I didn't know these other white people. I only saw them in the movies. But it was a shock, you know, because when I went there, this is in Topeka, Kansas. I had to look it up on the map, you know, in the middle of the country. But people were coming from all over the world at Menninger's. And I mean, I was a kid from the slums, and my world was like this, you know. And I feel sorry for the people there who had to see me when I first got there, because I couldn't communicate with them very well. I didn't understand them. You know, this was their cultural context. These were all wealthy people. There were actors there. There were industrialists there. These were people that I never knew other than in, you know, the movies. I didn't know how to relate to their context. I might be able to understand some of their personal issues here, but contextually, I didn't have the language. I didn't have the concepts, the perspective. I didn't understand what they were dealing with. Okay. It took a long time for me to really get onto that. So you feel kind of stupid, you know, and I was, you know, with respect to that. Okay. So we're trying to take in a broader perspective here. So we have here, you know, for minority therapists. Well, what I'm trying to say, what I want to bring up here, and I want to be, this is going to be part of my theme, is that, you know, we're talking about minority clients, but we're also talking about minority therapists. All right? We have a context, and our clients have contexts. Okay? And these contexts help define who we are, and how we see the world, and how we view ourselves. Okay? And I was that minority therapist, okay? Trying to understand these good white people who had problems and were hurting, and who I had trouble really making a connection with. Right? And that gets reversed when you have a majority therapist and a minority client. Okay? Context helps define, gives meaning to our experiences in life. And that also has to be taken into account. And then when you think about minorities, well, who's a minority? You know, people talk about, hey, you know, in the year 2050 or something, you know, the majority of people in the United States are going to be minorities, as if that really means a whole lot. You know, you can be black and you can be from Harlem, where I was growing up. You can be black and you can be from Jamaica, and that's a little different, you know, or you can be from Kenya, and that's even more different. Okay. I'm Puerto Rican, so you say, yeah, okay, he speaks Spanish, so he's Hispanic, right? Okay, so I go lecture in Argentina, and they speak a different Spanish there, you know. It's just like the difference between England and America. So I can't say terapista, I have to say terapeuta if I go to Argentina, right? And well, the Puerto Ricans very different from the Mexicans, very different from the Nicaraguans, very different from the Bolivians, very different from the Argentinian, and one thinks they're better than the other, you know. And so, you know, so this beautiful, you know, harmonious group of people called minority people, they're all busy putting each other down, okay? And there's conflict among them, okay? So let's not, you know, get romantic about these concepts, because then we just get more stupid than we are, okay? So what's the importance of this, you know, of what I'm just saying right now? The importance of what I'm saying right now, you know, is that every client we have, every individual, every couple, every family, everyone's unique. You know. So, I mean, really unique. You know, their own personal life experience is unique. You know. You can be born in the same neighborhood. You can be born in the same family. And if you're the oldest or you're the youngest, you had a different experience. So, you know, if you stand far away, you may all look the same, but if you get real close, it's really quite different. Okay. And as therapists, you know, we're not relating to stereotypes. We're relating to specific people. This individual, this particular couple, this particular family. Okay. And yes, we need to see the broader context. Okay, this person is from New York or from California, or whatever it is, that helps. But as therapists, we need to be going through the layers and seeing what specifically influences this person. Yes, I'm Puerto Rican, but I was born in New York, okay, and I was raised in New York. My parents came from Puerto Rico. You know, so when I go to visit Puerto Rico, they say, well, you're not really a Puerto Rican, you know, you're a New Yorkino. Yeah, all right. You know. However, I also didn't speak English until I went to school. I never spoke English with my parents. They only spoke Spanish. And does that mean anything? Well, I'll tell you a little story. When I was in Meningers, there were some of the South American professionals there were doing a little research about language and the effect of language on people's lives. You know, and so what they did is they came up with a questionnaire having to do with your own life experience. Right? And they were recording this, and it was a very standardized questionnaire. And what they did is they went through the questionnaire, life experiences, first in English, and then in Spanish. It's the very same questionnaire. Didn't mean much to me, so I thought, well, why are they asking me the same questions in another language? I want to give them the same answers, right? So I went through the thing very quickly and easily in English. Right? And then they asked me the questions in Spanish. Within 5 minutes, I was crying. I was out of control, emotionally crying. Okay. Things were affecting me. I was remembering. I was hurting. Okay. Suddenly, there was a whole part of me that I was unaware of. Okay. When I had to relate these things in my own mother language. Okay. So it makes me wonder how much of my life am I really living? I'm speaking all the time English right now, but there's some part of me, well, it does mean something. My experiences, early life experiences, and my relationships with my parents only existed in Spanish. Okay, so there's a very intimate part of me, okay, that exists in Spanish. And so language does matter. Culture does matter. Okay. You know, music that you grew up with, from a certain particular environment, different nationality, different culture, you're going to resonate to that in a way you're not going to resonate to music that comes from another culture, possibly. Okay. Okay. So there are hidden parts of us that are packaged, you know, in our culture, in the environment in which we grew up. So here I'm speaking to, well, there are minority therapists. That's a big word, big umbrella, but we're talking about people with very specific and different and unique experiences. Okay. And what we're pushing for here is right there, it says for minority therapists, it means accounting for a self that includes the complex psychological plus conflicted social forces in us. Okay. So that we each have our own very personal issues that we deal with. We also have issues with our culture. You know, in terms of our identity, how Puerto Rican am I really? You know, I have to work that out for myself, and I have to work that out with other people, you know, who are Latin. You know, I remember in where was it? Yeah, I think it was in Argentina. You know, people would attack me for not being radical enough and criticizing America enough, and and siding with these Yankees because I'm betraying my heritage. I said, man, I'm born there. What are you talking about? What do you expect of me? Oh, you were born there? Yeah. I speak the language, I speak Spanish, but I was born there. All right, we'll leave you alone then. You're another Yankee. So then I get put into another category. Right. But what I'm saying to you is that these social forces and influences, they're very much a part of who we are. And if we're going to understand people, if we're going to relate to them, we have to relate to them through our own cultural experience. But that's what I'm emphasizing here. Okay? If you want to relate to your clients, you have to be in touch with that within yourself. If you're not in touch with that within yourself, okay, you will not hear it in them. You will not look for it in them. It'll be something foreign to you. But if you're in touch with it as how meaningful is it to you, then if you open yourself up to your clients, okay, you'll pay attention to where they come from. Did they grow up in the Midwest? Did they grow up in the South? Did they grow up in New York? Did they grow up in Turkey? Did they grow up in Russia? Whatever it is, where did their parents come from? Did they come from two different cultures? All of that affects them, and it affects us as the people who do the therapy. Well, if we're going to take that into consideration, this is the worst possible time, probably in our history, for us to be doing that in a certain sense. In what sense? In the sense that we're, in the context of a society fractured over race, gender, and cultural values. We're practically burning down universities and institutions because we disagree with people, we shout them down.